afternoon. I'm Dr. Harpal Singh Selli. I'm working as professor and unit head and in charge surgical emergency in DMCH Ludhiana. And our hospital is one of the biggest in North India. And we have a dedicated emergency and a full orthopedic unit, which is a postgraduate teaching unit. Today I'm here with you to talk about commonly faced joint and bone problems by our people here in north part of the India. Very frequently people come and ask us is, why do I have joint pains when I'm not even having junk food or not eating any extra food? So the joint pains are not necessarily only because of food. I'm not saying that the food has no role, but food is not the only part which can cause joint pains. So first, let's talk of what are the different causes of joint pains. The first and foremost is being overweight. If you're obese or overweight, that can result in joint pains. Genetics does play a role with people towards joint pain. That doesn't mean when I say that genetic plays a role that everybody in the family will have it. But if someone in the family is suffering from joint pains, the likelihood of other members of having joint pain are much higher than in a family where nobody has joint pain. And this is specifically true for some kind of joint pains like rheumatoid arthritis. I would also like to mention here that junk food predisposes you to joint pains and bony disorders by two means. First, when you eat junk food, you're likely to gain weight and become obese. Second, there are certain components which are part of the junk food, like refined carbohydrates and trans fats, which will result in inflammation. Now, what is inflammation? Inflammation is actually a kind of a swelling which is inside the body. And that inflammation will damage the internal structures, and it specifically damages the joints and causes bones to become weak and result in pain. Now, let's go back. When I don't have junk food, I still have pain. Junk food people will also have weak bones, what is called osteoporosis, or that will also result in pain. But again, once again, I'm reiterating that doesn't mean that people who do not eat junk food will not have osteoporosis. Osteoporosis also has a genetic bearing. So these are all very complex issues and they are intertwined with each other. The genetics will result, you must have seen some grandparent in your family or in your friend's family who are stooping forwards in what we call kyphosis, ਜਿਹਨੂੰ ਪੰਜਾਬੀ ਚ ਕਹਿੰਦੇ ਸੀ ਕੁੱਬ ਨਿਕਲ ਗਿਆ. The families where osteoporosis is common, it is passed on from generation to generation. I'm not saying something totally preventable, but we can of course decrease the severity of osteoporosis and we can decrease the incidence of osteoporosis. The second most commonly question that I face is, are my pains only due to age or is there something more to it? Many patients will come and say, doc, get me tested, I might be having some underlying disease. So there are clear-cut things which will point towards an additional disease which is resulting in joint pain and is not only age related. When I say age related, these pains usually will start after the fourth decade, something which starts 45. Very few people will have it at 40s, usually more common at 50s and much more common in 60s and beyond 60s. But if somebody comes to me with joint pains at 30 years of age, at 20 years of age, and sudden onset, when I say sudden onset, I mean which starts all of a sudden. 5 days back you were normal and suddenly now you cannot walk. This is unlikely to be age related. That means there is something underlying which has resulted in a sudden joint pain. Age, as we say that aging is gradual. I give an example, all your hair will not become white overnight or within 2 months. They'll gradually, you will have first a gray strand of hair and then maybe one side of the hair will become gray and then slowly it will spread. So the joint pain which comes with age will be gradually onset, means slowly it will increase and is usually bilateral. When I say bilateral, means if your knees are paining, both knees will start paining. If your hands are involved in elderly patients, both hands will be involved. It will not happen that only one knee is getting the pain and the other is normal, because both knees have aged together. The Best, and the third frequent question that I hear when I say best means because that can make a difference is how can we delay or how can we prevent to have joint pains? So it's a very simple thing. I would say change your lifestyle. Rather than treating as a aging disorder, I would say treat it like a lifestyle disorder. What I mean by lifestyle, we should be exercising regularly, we should eat a balanced diet, we should be keeping our weight in check. We must do not only muscle training exercises but also stretching exercises. And you'll be surprised that even as a qualified orthopedic surgeon, I would say stretching and muscle strengthening along with yoga. Yoga is a kind of stretching, and to some extent it also involves muscle strengthening, is a good exercise to keep your joints healthy. What we face nowadays a lot in youngsters, that is posture problems. Because of lot of technology coming in, majority of the population is working indoors and are focused on either computers or on desk jobs. So these are the people who are more prone to problems which are related to posture. Of course, posture does play a role. The reason being, first is there are abnormal stresses on the joints. The muscles will become sore if you do not sit in proper posture. And while sitting, a lot of people have backache, and that is because the sacroiliac joints of the body, they go under strain. When I say sacroiliac joints, these are the main joints which attach our spine to the pelvis, and when they undergo strain, that results in backache. So the good way is that you change your ergonomics. If you are working on a laptop, please don't work while sitting in the bed. You should adjust your table height according to your own height, that the laptop faces you directly. And the people who use mobile day in and day out, and especially with their head down, or they use their mobile phone while lying down in the bed, these are the people who are prone to postural neck pains. After backache, neck pain is the second most common thing that comes to me as a senior orthopedic surgeon and is mostly related to posture. Now, a lot of people ask me, are women more prone to joint and bone problems? The answer is definitely yes. There is sexual differences also, and second, it is genetic also. There are certain diseases, of course, they involve joints and bones are more common. Like rheumatoid arthritis is more commonly, ਜਿਹਨੂੰ ਗਠੀਆ ਕਹਿੰਦੇ ਅਸੀਂ ਪੰਜਾਬੀ ਚ, which involves weakening of the bones, is more commonly seen in women, especially after the childbearing age is over. When I say that, I mean menopause, the periods stop, the protection provided by the hormones is gone, and then the bone loss is much faster than in males, and therefore they are more predisposed to osteoporosis, which is weakening of the bones. The fractures are more common because of osteoporosis, like distal and radius, which happens to be the commonest fracture that we see in elderly, and also the hip fractures. I'll also take this opportunity, since I'm here, to share with the common people, common man, that please do not take painkillers with your own will. These are not the drugs which have no side effects. Prolonged analgesic use, if you take these drugs regularly over a long period of time, they can cause damage to your kidneys. They can also cause damage to your liver. So please, in case you have to take, the most safe out of all is paracetamol, and this can be taken. But my suggestion would be that if you have to take more than 5 tablets in a week, you should consult an orthopedic surgeon to find out what is causing this pain and get treatment of the cause rather than take painkillers. I'll also like to clarify now to the general public at large that not all joint pains are treated by surgery. This is a misnomer that if we go to a doctor, he will advise us surgery. Let me share, the people who require surgery are less than 10%. Rest of the people are managed. When I say managed, means they are treated without any surgery. It depends on the cause. If it is rheumatoid arthritis, ਜਿਹਨੂੰ ਆਪਾਂ ਗਠੀਆ ਕਹਿੰਦੇ ਆ, that is totally managed with drugs. There are specialized drugs available nowadays which give you very good results, that rheumatoid patients do not develop any deformities. The osteoarthritis, which is also called joint pains of the age related joint pains, the joints get damaged. Here also it is the lifestyle mainstay of the treatment that we advise regular physiotherapy, regular exercises, weight control, and certain modification of lifestyles that will result in better joint function. Certain injuries which can cause joint pain are also managed or treated without surgery. They do not need surgery. When we talk of most common thing, that is osteoarthritis, which is age related, first is drug treatment, second is advise exercises, we advise supplements, next is walking aids, again exercises, then we have injections which can be given. Surgical part is towards the end, the patients which do not improve with anything or have limitation of activities, that is when we advise surgery for these patients. You must have heard a lot about that the young people are facing bone and joint issues, and especially in the North India part, this is very common. So this statement is not factually wrong. It is in fact right statement that youngsters are getting pains which should not actually be the norm. One of the reasons is that indoor lifestyle. The people are usually indoors. They would reach work very early in the morning when there's hardly any sunlight, especially in the winter weather. And by the time they are free, it's already sundown. So the exposure to sunlight is very less, which results in vitamin D deficiency, which is very, very common in north part of the India. Second is other vitamin and mineral deficiencies. Third is the food fads that are common these days. Because of the food, the nutrition is not adequate, and that results in deficiencies which can result in joint pain. Lack of exercise, they are more overweight and obese because of the lifestyle problems. Majority of the jobs involve prolonged sitting with postural problem that also results in joint pains. A lot of people ask me when I give them a prescription also, ki doc, can I take multivitamins, calcium, and continue to take it even after your prescription? Many patients come to us and they say, oh doc, I've been taking calcium for last 1 year or maybe for 2 years on my own. My answer to this is, please don't self-medicate yourself. Self-medication in any form, maybe multivitamins or calcium or vitamin D, can result in toxicity, and it is not unknown. We do see patients with vitamin B12 toxicity. We also see patients with vitamin D toxicity because people take it on their own and do not take the proper dosage as is required, and that can result in some serious consequences. The reason I say should not do it is, even if 1 out of 1,000 has this problem, which is totally preventable, in my opinion, should be prevented. In India, healthcare is not that expensive. Any and everybody has an opportunity to seek a consult in the free hospitals, in the charitable institutions, or in the private hospitals, and should use that to take medications in any form rather than doing self-medication and creating a problem. Thank you for the interaction. Keep watching Health Plus, keep on interacting with us, and we look forward to more questions from you.